When CJ was just days old, he gave his mom and dad the scare of their lives. They brought him home following minor surgery, and he began bleeding for hours on end.
Going to the hospital and sitting there all that time and your baby keeps bleeding, you know, it was frightening. I just didn't know what was going on.
When you're in a place where you cannot help your child, you just feel totally helpless. And so that's kind of where we were at the time.
Tests revealed CJ has hemophilia, a genetic condition that impairs the body's ability to stop bleeding when a blood vessel is broken. It's one of many medical conditions families manage at home with the right medicines and the right knowledge.
Anytime when I get hurt, I really need to do something that's called factor. My mom, she has to give me a shot, but it really doesn't hurt very much because I'm used to it.
Learning to deal with chronic medical conditions at home can take time, and that's why time spent here is time well spent. This is the Nursing Institute's Living Laboratory in Centerville, Ohio. It's a first-of-its-kind training and demonstration facility. Family members and nursing students learn home care here from some very high-tech patients.
Can you tell me how your foot feels today?
It's a little sore, but the pain is less.
Great.
Meet the Techie family, the patient simulators at the Nursing Institute's Living Laboratory. See them breathe, listen to their heartbeats, hear the grumble of upset tummies, check their pulses, and draw blood from their veins.
The simulators here are nice because you can actually program them to simulate various diagnoses or problems, whether the patient be an amputee or had a stroke or heart attack, whatever, they can simulate that. And then you get more of a feel for what you're dealing with.
Part of our skills on the job is either as a nurse or a therapist is being able to read the person that you're intervening with.
When doing a physical assessment on a patient, if your patient's able to communicate with you and tell you this necessary information, you can better serve them and treat their condition.
Dayton-based Fidelity Healthcare is a supporter of the Nursing Institute's Living Laboratory and plans to train home healthcare providers here.
There's an immediate need for nurses to be trained on IVs, for instance. And that's not an easy thing. You have to learn where those veins and arteries are, where to align to put a needle in. What the beautiful thing is that here at the Living Laboratory is that they have mechanisms to do that.
Whether it be a home care aide or a therapist or a nurse or a family member that needs to use it, it's ideal to come in here and run through the training with using the patient simulators as the patient instead of trying to teach them on a one-on-one basis in each individual home.
For professionals and family caregivers, interacting with patient simulators like Matt is a very different experience from learning lessons in a classroom.
They're just like a person. They breathe, they cough, they talk, they have veins. They can do everything essentially that a person can do, and I can't hurt them. So it's very resourceful.
The Nursing Institute's Living Laboratory looks and feels like a home, and that's helpful in teaching trainees important cautions about home care.
Things that you or I may overlook on a day-to-day basis, but having a patient who is ill, you want to ensure that patient's safety, along with the safety of the remaining members in that family.
Established in 2009, the Nursing Institute's Living Laboratory is backed by partners including Wright State University, Sinclair Community College, Premier Health Partners, and GraceWorks Lutheran Services. This unique facility has been attracting national attention. Soon, there will be more training centers across the U.S. based on this model. And that's fine with home caregiver Beth Bowles, who would like to see more families benefit.
And especially someone who just finds out about their child's illness, the Living Laboratory would be wonderful because it's an eye-opening experience. And especially if you are just getting into your illness and you're not sure what to expect, this would be a great help to families like that.